only a very small percentage of breast cancers are genetically connected. When you take the whole of all cancers in general,
Hmm.
5% are genetically connected. That means we have a lot of say in what's coming in and happening to our body. So we have to be aware of what we're putting on and in our body. I think it's just kind of, I don't know, I guess like it's I wouldn't do it. I wouldn't just wait and not do something proactive because
Hmm.
you're going to pay for your health at some point. You're either going to pay and invest in it up front so that you can maintain your health, or you're going to pay someday because you're sick and now you have to deal with the consequences of that. I would
Right.
rather pay up front and invest in my health and be proactive.
Welcome to Take Back My Brain with Laurie Hammer, where real healing starts in the brain. I'm Laurie, a functional nutritionist and mom who's walked the path from anxiety and burnout to clarity and calm. Each week, we're going to dive into brain-based tools like amino acid therapy, gut health, fasting, and faith to help you reclaim your energy, emotions, and sense of self. Well, hello, beautiful friends. Welcome back to the Take Back My Brain podcast, where we talk about natural ways to calm the chaos, to nourish your body, and to restore your God-given design for vibrant living. I'm really excited about today. This is going to open your eyes as we dive into a very powerful tool for early detection and whole body wellness. It's called thermography. So, if you've never heard about it, my guest today, Maria Campbell, is going to tell us what thermography is and why it is a good tool to have in your toolbox to make sure your body stays healthy all the time, inside and out. So, Marie, welcome to the podcast.
Thank you.
So, I'm so curious. Can you tell our listeners what is thermography?
Sure. So thermography is a tool to use in order to detect inflammation in the body. So it's using an infrared camera that is specifically calibrated for the human body. A
Hmm.
lot of the cameras that you find out there are more industrial type cameras that are used in construction and things like that. And as thermography has become more used for the human body, some of those companies have kind of started to calibrate them in order to be used that way. So the type that we use is specifically calibrated and manufactured for clinical use for the human body. So what we do is it's sort of like taking your pictures. You're really just your body is always sending out thermal signals,
Okay.
especially when there is inflammation or some sort of dysfunction or dysregulation in the body. So an infrared camera like what we use detects that. It's just detecting the signals that your body is giving off. So it's not putting anything out. There's no radiation. It's non-invasive. It is pain-free, touch-free. You're really just sitting there getting your pictures taken. And then what you get is images that show an inflammatory map of your body, kind of those hot spots where there's increased inflammation, increased blood flow, and maybe even lymphatic congestion. That's a big one that we can detect too, which is really
Nice.
exciting because it gives us some practical ways to give you some things to start working on right away.
Wow, that's amazing. How did you get into this?
So, like most natural journeys that I think people find themselves on, it started a completely different way of just kind of trying to figure out health for my kids, for my family. We had some just, I'd say chronic things happening that we just weren't getting answers from your typical Western medicine models. Found our way into natural, more
Hmm.
functional medicine. One thing led to another, and I became, closer to that age of 40 when they start talking about, you should really do this or do that. And I thought, well,
Right.
I wonder what else is out there. And so I just started doing some research on my own. I actually talked to a doctor. I had to have a physical for some training that my husband and I were doing. And the doctor said, it's that time. I really want you to have a mammogram. And I said, well, I'm really curious about thermography. Do you know anything about that? And he actually said, I do actually. And he said, I think it's really valid. And I think
Oh,
it's a
nice.
matter of time before insurance covers it. And I was like, whoa, not
Whoa.
expecting that.
Right?
That kind of gave me just some encouragement to explore that. And
Yeah.
so I did. So I started having it done for myself. It's probably been 8 years ago now that I
Hmm.
started getting it done myself. Started somewhere else and then realized the difference in the technology that we have at our office and switched over to our office a few more, years into that. And gosh, about 3 years now, as a patient, came across a listing for the job and thought it was
Wow.
crazy, didn't think I was trained or certified. Who am I to do that?
Mhm.
And one thing led to another, and I would say God led me to this totally,
Yeah,
put things together for me, and here I am. So I was trained and certified as a clinical thermographer, and that's what I do.
that's
So
amazing. And your clinic is in, where's your clinic located?
it's in Urbandale. It is
Urbandale? Okay.
Mend Thermography. It's at 86th and Douglas, and we don't just offer thermography. Super exciting in this past year, we also brought in ultrasound in-house.
Nice.
And so for people who, know they have dense breasts and know that mammograms can be kind of inhibited by those, um,
Mm-hmm.
they are often not able to get to an ultrasound without having to do that mammogram first, or still maybe just not allowed to. In our clinic, you can actually self-refer or be referred from your physician to come in and do breast ultrasound, but our sonographer can do any kind of ultrasound as well. So we do thermography, ultrasound, and then a couple of massage girls in there as well.
Right. That is, oh, that makes me so happy. That is just
I
so
know.
key
It's so
to
exciting.
women's health because how do I say this and not, sound snarky? I'm just gonna maybe I'll just sound snarky. It's fine. It's like we just don't get good care.
Yeah.
When most of the time when we go to mainstream medical, one, we're not heard. If you have those dense breasts, if you have a family history, there's all sorts of emotions that go along with all of that. And so I think having the option to be able to self-refer is the way it should be in the first place. Like you're in charge of your own healthcare, so why can't you do that all the time? So I love the fact that you now have not just the thermography, but the ultrasound in it as well. Um, can you
And can I jump
describe?
in real quick before you go on there? You said the word option, and that is something that
Mm,
we feel very strongly about, that all of these tests are just options for us. There's no perfect cookie cutter way for us to do breast health because we all have, like you said, different risk factors, different
mhm.
lifestyles. Really, a combination of a couple of those tests is what we recommend for a more comprehensive breast health screening. I personally wouldn't do just one of any of those because you're
Right.
only getting so much information. And so we really recommend picking a couple of different things. And we can get into more of how they're different if you want to go that
I
direction.
would love to go into that. So if you could outline that.
Yeah, so the easiest way to explain like what thermography is to compare it to ultrasound and mammogram. Those tests that we're more familiar with are tests of anatomy. So the ultrasound, MRI, and mammogram. They're looking at the structure of the breast, the physical anatomy, looking for a small structure within that breast structure. With thermography, we're not looking at the structure of the body at all. This is a test of physiology. That means
Okay.
the function of the body. So what we're watching for with thermography is the potential for early disease process to be starting. We don't want to wait until something is large enough to show on a mammogram.
Right.
Typical growth is about 8 to 10 years before it's detectable on a mammogram.
Mm-hmm.
I don't want to wait that long and be that far behind it, right?
Right.
But what happens in the very early stages, if the body allows cancer cells to start growing, what happens is a process called angiogenesis, and that just means increased blood flow. And the body will feed that area with increased blood in order for those cancer cells to start doubling every 90 days, is what happens.
Wow.
So we're talking early process where there's not even a structure big enough for any test to detect it really.
Mm-hmm.
And within about 2 to 3 years of that growth in the very early stages, that is when thermography is known to be able to start detecting some change that's happening. We might see more inflammation. We might see more vascular patterns forming that weren't there before. So thermography is all about consistency and stability is what you want to see with that. You want to see things be very similar because when there's change, when there's increased blood flow, typically that only happens if pathology is developing.
Got it.
And so again, coming back to all of those tests, that's why it's so important not just to look for that early disease process, but also to be looking on something like an ultrasound to see, are there cysts? Are there papillomas? Are there lipomas? Are there other things there physically that really still should be monitored and still could cause
Mm-hmm.
other problems, even if it's not always leading to the big C, right?
Right.
So we really recommend doing a couple of different types of tests like that.
So it's not just detecting the big C type things, but you're saying it can detect other
For sure.
abnormalities in the body as well.
Yes, yes. And so although breast imaging is probably 75% of what I do,
Sure.
we actually do full and half body as well as region of interest too. So like sometimes people will come from their dentist or their dentist will send
Mm.
to us to have further imaging for the neck and the head to see how far infection has gone.
Okay.
And so that's an interesting one. There's some autoimmune points on the body that we can
Yeah.
see. There are things for prediabetes and insulin resistance that show on your hands, oddly enough.
Really?
Yeah, and so there's kind of a stroke risk assessment looking at the carotid arteries to see if there's
Oh.
increased heat there that could be showing some occlusion starting there. So
Mm-hmm.
thyroid function, I mean, organ function, just so many things. Varicose veins, that's a huge one that can really be seen pretty obviously on thermography. So it's not just for breast health.
That's amazing. I didn't even think of some of those things. So
Yeah.
if we're talking about, because I'm thinking of a couple clients with some varicose vein issues, how does it help with that? Like, what is it showing you in regards to that?
Yeah, so um, they're very easy to see. I'll say that. It's kind of fascinating to be able to see these lightning bolts down the leg. It
Interesting.
really defines exactly where they're at.
Uh-huh.
So it's a way to monitor them for one thing. Thermography is a screening test. It's not a diagnostic test. And so
Yeah.
it's not going to diagnose and say, like, there's a blood clot or there's this, it's going to say there's some sort of dysregulation or dysfunction here. Here are
Hmm.
some things that you might want to follow up with in order to figure out what's going on. One instance with varicose veins that happens often, I would say, is people present to me sometimes with knee pain or ankle pain or just a throbbing pain in their calf.
Hmm.
Varicose veins aren't always noticeable.
Right.
And so sometimes when we see those images, it just clicks. They're like, oh my goodness, that is exactly where that pain has been. And they
Hmm.
just haven't been able to see that yet. And so it kind of, I guess, validates for people like there is something going on there. It's
You're
not just,
not crazy. Yeah.
yes, yes, totally. And that in itself is really important because with people like with autoimmune diseases like fibromyalgia and things that
Yeah.
are chronic pain, unfortunately, people do get told it's just in your head,
Yeah. I know.
you need to relax or you need to sleep more or whatever. And so this really can be a way of validating people's feelings and showing them that no, there really is some inflammation there that really needs to be dealt with.
That is
It's
so
quite
good.
fascinating. Yeah,
Yeah. Well, it just gives people hope, right? And then it can, send them in the direction they need to go. So, do
right. And
you
that
recommend thermography as sort of like a yearly thing or just for overall health monitoring? What do you recommend?
Yeah, people use it in a lot of different ways. For breast health specifically, what you do with that is no matter what test you start with, if you have a half, a full, or a breast only, you do that first one, and that kind of gives us what we call your thermal fingerprint. And then the doctors ask you to come back again in 90 days to just do the breast images.
Oh,
That is what establishes the baseline because they don't know prior to your first one what things have looked like.
right.
So looking again in 90 days gives them that window of time that if there is that process of angiogenesis happening, we might continue to see some change happening.
Mm-hmm.
It doesn't, that establishes your baseline. So those first two are your baseline for women. And then they do recommend annual after that, especially for the breast. So at least doing, thermography of the breast annually. I have a lot of patients though who love how this just kind of helps them monitor, progress or things
Yeah.
that just maybe they're not somebody that, goes to the doctor a lot or does, and they like to use that as a tool to kind of see how things are progressing annually. So it can be used in a lot of different ways. I would say too, it's also because it's so safe, there's no radiation, it's not putting anything out.
Yeah.
You
Which
don't
is
have to
amazing.
wait that year too. I tell patients all the time, if you suddenly 6 months from now feel a lump or have a concern because there's a new pain or
Mm-hmm.
come in, you can
Yeah.
come back in at any time and they can monitor and see, our doctors are MDs who do our interpretation.
Oh, okay.
Um,
Mm-hmm.
we have about 40, over 40 now. MDs, obviously more integrative, kind of holistic minded.
Mm-hmm.
They are board certified physicians in practice, and then they're also board certified thermography interpreters. And so
Oh.
they're board certified in two different ways. And the report that you get when you have this done is directly from the doctors.
Oh, wow.
We
Okay.
assign you a doctor, we send out to a medical system, and they assign a physician to read your report. And then we email that report right back to you. So it's the actual medical
Yeah.
report like you would get for any other type of test that would be run, and you get those images in there too. So you really, a lot of people, I think, use it as a compass. That's what I
Yeah.
suggest, is use
Yeah.
it as a compass. Like, look through it, kind of see based on what you're feeling and what they're seeing, prioritize then kind of what are some of the things. Like if you are already fatigued and you're showing, having weight gain and all these issues, and you come back with something showing dysregulation in your thyroid,
Yeah.
obviously I would start there. And the doctors often will say, like, have a thyroid blood panel done, maybe even an ultrasound to look for nodules. They're pretty specific. So you kind of have to, like you said earlier, be an advocate for yourself and go
Yeah.
forward and do this. So,
Yeah. Wow. Do emotions or stress or trauma affect the imaging at all?
I wouldn't say specifically, but there are times when obviously emotions and stress are going to cause a lot of extra inflammation.
Inflammation. Yeah.
For sure, for sure. So when we look at the back, for instance, we carry so much of that stress and tension,
Mm-hmm.
and we'll see just a lot of that happening. And usually people look at that and they go, "Oh yeah, I know the week I've had, or what I've been going through." And so yeah, it's definitely whole body, very holistic, where everything is connected. So I would
Yeah.
say definitely there is, and there are times too when, recently I had someone who she was taking a B vitamin complex, and she had been experiencing some kind of niacin flushes, I guess is what you would call it. So
Uh-huh.
she was having some flushing and hot, just feeling hot and flush. And we could not do her images that day. She was in the midst of
Oh.
one right then. And so I said, I'm sorry, I saw the one that you had 3 months ago. This is
Uh-huh.
going to be a baseline. Like, we need to reschedule this. And don't take that right before you come. So, there are things like that that can have to be careful with. So,
Yeah. Are there any precautions in regards to thermography?
just things like don't do something that's heat producing right before you come. When
Okay.
you make an appointment, we send with the paperwork kind of some protocol. Don't take a, super hot shower right before you come. Don't wear
Mm-hmm.
deodorant or lotion or anything like that in
Okay.
the areas that will be imaged. Don't use your seat heater coming over, sit in the sauna that day. You kind of want to just
Oh, that
regulate,
all makes
let
sense.
your body, yeah, yeah.
Yeah.
So.
Yeah. Are there any things that you commonly see that surprise a lot of people, like things that we wouldn't even think about?
Actually, yes, I would say that pre-diabetic marker that I mentioned. So the way it shows is on the hand images, the hand kind of looks like it's wearing a glove, and it's usually like a orange, darker
Oh,
orange or even red sometimes, where green is kind of a middle of the road color. When you suddenly see these glove-like images and maybe red hot heat on the fingertips, that is definitely a sign that there is some metabolic dysfunction happening, and
interesting.
oftentimes that is something that's really a wake up call for people to go, oh, I knew they were concerned I'm pre-diabetic, or, they've been watching my numbers. And so that was sometimes it's just kind of the extra little kick that somebody needs to go, okay, your body's crying out for
Right. Here
help,
it is on the image.
yeah,
Hmm.
you can't deny that anymore. I think the obscure numbers out there somewhere can be like, oh, you can just ignore that. It's hard to ignore it when you see it, and the physiological things often show before we notice symptoms.
Oh, so
And so
much.
that's pretty fascinating to see some of that. Yeah.
Yeah, that's really interesting. Does it show up in the feet too, or is it just the hands?
Typically more so the hands. Yeah.
Interesting. Huh.
Yeah.
Okay. Do we know why?
My unscientific theory
Yes, your unscientific theory is.
is that there's early nerve damage starting. It's not full on neuropathy, which happens later, and then the fingers get cold. It goes to the other
Yeah.
extreme. But that's what I would say is there's something off with that blood flow, that nerve damage, and so yeah, it is interesting how the body talks.
Mm-hmm.
The body is always trying to tell us something. I just think we haven't even scratched the surface of finding ways to
Oh,
understand what it's trying to tell us. And
definitely.
for instance, there's a point called the autoimmune point on the back of the neck. It's up
Okay.
here on the T1 and T2 vertebrae. Oftentimes we will see that get really cold. So you'll see all of this muscle tension around the neck and shoulders and the back. And it's not that you just don't have any right there in that spot. That spot is connected to your immune system.
Okay.
And so chiropractors always love this. I have a lot of chiropractors who are patients and
Uh-huh.
they validate this for me all the time because they're like, yes, oftentimes when someone's sick and they come in for their chiropractic adjustment, it's the T1 and T2 vertebrae that needs to
Yeah.
be adjusted because it's connected to your immune system. And so that spot tends to get colder and colder, especially as you move into kind of full-blown autoimmune things.
Mm.
But it can also show when you're dealing with things like seasonal allergies, food
Oh,
sensitivities, even just stress or hormonal imbalances and things like that. So that's pretty eye-opening too for some people who are kind of like, I've been wondering,
yeah.
kind of encourages them to dig a little deeper and see what they can learn. And I did recently actually just have a patient come back and say, I went and did some testing. Sure enough, I actually do have autoimmune disease. And so that was something that spurred her to move on from that.
Yeah,
So
to be more proactive.
for sure.
Yeah. No, that makes sense. Is there a particular stage of life that you're like, okay, start doing thermography now? Or is it good for like my daughter's 18? Should she start doing
Mhm.
thermography?
Great question. So no, I would say I wouldn't have her start at 18. I have
Okay.
an 18-year-old as well, and I've
Hmm.
practiced on her before, and they're so full of hormones. There's just it's a lot of heat.
Oh, funny.
So what we recommend now, I can absolutely image someone in their 20s.
Uh-huh.
Under 18, we do have to have a doctor referral. We cannot do children. However, in the 20s, I've had girls who do have a lump or a concern, and we do get that baseline started that early. We typically recommend by 30. That
Okay.
is usually as hormones kind of start to regulate a little bit more by age 30. So we recommend getting the baseline around then. Then it
Hmm.
can be tricky for some women because then you start having babies and you have to be 3 months post nursing or delivery
Oh,
in order for hormones again to kind of calm down. And so you do have to give that waiting period in there. So that's what we would say, but it's for men and women of
hmm.
all ages. I would say 23 is probably my youngest patient, and I have at least one 80-year-old, that still likes to come in and be imaged, because a lot
Just
of times
proactive. Hmm.
as you get older too, they don't recommend as many tests because
Right.
they just kind of figure, what are you going to do with it anyway, but some people
Yeah.
are still trying to be proactive and healthy into their 70s, 80s.
Right. Well, my aunt she was diagnosed, she's 80 and she just got diagnosed with breast cancer. And so she goes, and I felt this little thing that was off for a while, but they don't do mammograms on me anymore,
Right.
all
Right.
those kind of things. And so, something like this for that older population as well could give them a peace of mind or help them to be more proactive. And so then they're not forced into, okay, you have to decide tomorrow what you're going to do at age 80 with your breast.
Right, right. Yeah, for sure.
Yeah. Can you just speak to just kind of women's health in general as to kind of what you see, how thermography kind of changes the landscape of that? Or I know it's more proactive for people, but could you dive just a little bit deeper into that?
Yeah, so I would say a lot of the women that I see are around the same time of life as me, going through
Hmm.
those menopausal years. We have just so many great conversations every day about, oh, it's you too. Oh my gosh, I get it. Like I
Hmm.
understand because I feel like in that time of life, there's just not a lot offered to us. It's
No.
kind of just like, suck it up, buttercup, you're gonna be
Mhm.
fine, or we're just pushed aside like you're so emotional and whatever. There's a lot going on in a woman's
Yeah.
body during this time. And so I do feel like thermography is it's a great tool for people to use to kind of, again, monitor like therapies and things that they may be doing. Our nurse practitioner who owns our clinic, she works with women's health and hormones and as well as integrative oncology.
Nice.
She uses thermography as a tool to
Hmm.
monitor therapies, to be able to say, like, okay, we're working on some of these things. We're trying to bring that inflammation load down because inflammation is precursor to pretty much every disease, right?
Mm-hmm.
That systemic inflammation has to be dealt with at some point. And
Yes.
so she uses thermography as a way to kind of balance that and say, is this protocol working? We've been doing this for a
Mm.
year, maybe we need to change something up. And so I would just say when it comes to women's health, I'm not an expert, but I'm definitely in the throes of it. And I cannot recommend enough to find someone to work with. You do not have to struggle alone through these years of perimenopause and postmenopause. Finding a good functional medicine provider who can figure out what your body needs before you're completely depleted of everything.
Right.
Maybe for some people it's hormone replacement therapy. I am not going that route personally because supplements have done it for me. Like that's making
Mm-hmm.
a difference in my life. But I think it's really important to dig deeper when we get into these ages, this like stage of life.
Yeah,
The
because
things that
we
worked in our 20s
normalize.
and 30s don't work anymore in your
No,
40s.
exactly. And then we normalize things like, oh, this symptom or that symptom, I'm not sleeping, I'm having hot flashes, my breasts are sore all the time. Like everybody has it, so
Yeah.
it's just normal.
Yeah.
But it's still a dysfunction and it might be common, but it's not normal. And I
Yeah.
feel like this is another tool that people could use to help them figure out what that dysfunction is and
Mhm.
then move towards addressing that in a more systematic way.
Absolutely. And definitely that's where like the thyroid comes into play too.
Oh,
That's
sure.
so connected with everything. And, again, it's kind of, okay, I'm tired all the time. Is it just because I'm, this age and I'm doing this, or is it because my thyroid isn't functioning well and it does
Yeah.
need some support? And so it is a great way to, shine light on that.
So if I were to come to you and my thyroid looks inflamed, what does that look like on the scan?
So sometimes so the thyroid is this little butterfly shape in the base of your neck. It's a little bit different for everybody depending on how tall you are. So it's hard for me sometimes to determine where it is. That's why the doctors get to be the doctors and I don't have to be.
Mm-hmm.
Other times it really shows and I can see warmth over that thyroid. That could mean something like thyroid nodules. That could mean just dysregulation that needs to be balanced with some extra help. Other times it's really cold. So there's times when it's
Oh,
cold and maybe it's not functioning well at all,
mm-hmm.
and so it can be one extreme or the other. We're not
Interesting.
always just looking for heat when it comes to thermography in general. Things that can show colder would be things that are more dense, like dense breast tissue,
Mm-hmm.
upper arms, thighs, abdomen. It just looks colder. So it's not inhibitive like it is on other tests with density and things like that. It just looks a certain way on thermography. Fluid-filled cysts, things like that are going
Mm,
to look colder. So there's a different, not necessarily concern, but there's a different way of looking at those things as well because they're so cold. Cold
right.
toes, cold fingers. Okay, circulatory, metabolic, something happening here.
Right. So if your thyroid is showing up cold, does like the pituitary hypothalamus show up as well? Does is
So
there?
we actually
Oh,
cannot image the brain at all.
oh, I didn't know
So
that. Okay,
yeah, the
good to know.
brain, there's three areas that really are not able to be done by thermography, and that's the brain and the prostate and the testes.
Mm,
I would add to that outer female private parts just because those areas are so hot.
yeah.
There's no close-ups or anything like that that are going to take place.
Oh,
For men
interesting.
with prostate and testes, there are better tests for that.
Mm-hmm.
And again, it's regulating temperature would be next to impossible for that. When it comes to the brain, because of the skull and the blood-brain barrier, we're not able to actually see that. So when we do the head and the neck images, that will show things like sinuses, myofascial
Oh, okay.
tension,
Mm-hmm.
inflammation through the nasal cavity or sinuses, dental inflammation, lymphatics all through the neck. There are signals for TMJ behind the ear,
Really?
lymph and muscle stuff going down the neck. So just so many different signals that the doctors are able to determine what is
Wow.
trying
I
the
had
most.
no idea it was that comprehensive.
Yeah, yeah.
Yeah. So what do you say to a woman who says, I feel really healthy, my breasts feel good, like I feel good from head to toe? Is there a reason to do this?
Absolutely. Because you want to stay feeling good.
Yeah.
Why wait until you don't feel good to start being proactive is my thought. So we talk a lot about just breast education. In your first appointment with me, I spend over half the appointment just educating on breast health and lymphatic health. The lymphatic system is so important when it comes to breast health. If you're not doing anything, even if you feel good right now, and you're not intentionally doing anything for your lymphatic system, I would venture to say it's just a matter of time before you regret that. It will catch up. Your lymphatic system doesn't have a pump of its own. It
Mm-hmm.
depends on us to be moving it, to be doing pumping or thumping. Some people like to do
Yep.
things like this. And there are so many great, easy, free techniques that you can do at home for 5 minutes a day. There's
Mm-hmm.
no reason why everybody shouldn't be doing those because that's the waste management system of the body.
Right.
It is going, that fluid flowing through our body looking for bacteria and viruses and toxins. It's important to know that 85% of breast cancers are environmentally connected. That means
Right.
the toxins we're coming in contact with. Only a very small percentage of breast cancers are genetically connected. When you take the whole of all cancers in general,
Mm-hmm.
5% are genetically connected. That means we have a lot of say in what's coming in and happening to our body. So we have to be aware of what we're putting on and in our body. I think it's just kind of, I don't know, I guess like it's I wouldn't do it. I wouldn't just wait and not do something proactive because
Mm-hmm.
you're going to pay for your health at some point. You're either going to pay and invest in it up front so that you can maintain your health, or you're going to pay someday because you're sick and now you have to deal with the consequences of that. I would
Right.
rather pay up front and invest in my health and be proactive. So,
Yeah, me too. Any specific things you want women to know about breast health? So you're talking about moving your lymph. Are there any other things?
breast massage is a big one I teach too. We all have, I think, that ingrained in us that, oh, I have to do this exam, right?
Mm-hmm.
What I see with my patients is that they come in and when I ask, are you doing a monthly exam? And oh, I try to, I always forget. And because they're only trying to do it once a month, right?
Right.
And they do it from a place of fear and worry and anxiety, looking
Right.
for a problem. You and I both know that is not good for our health. That's
No.
not good emotionally to be coming out our body in a place of fear. So we like to turn that on its head and say, here's the thing. Your breasts need movement. They don't need to be stagnant all day and stuck in a bra. Bras weren't designed for our health or
No.
and so
I just want to
get
take
as
mine
much as
off.
possible. I know. But instead of doing that exam from that place of fear, let's just get into a habit of when you're in the shower and you're already soaping up, give your breasts some intentional palpation and some massage. When you
Mm-hmm.
lay down in bed at night, get into a habit of just feeling and giving them some massage because they need movement and
Mm-hmm.
they need airflow and
Yes.
they need to breathe a little bit. You are going to become so familiar with your own breast tissue, which is different from every other person in the
Yes.
world, that you're going to notice if something changes. You don't have to go looking for it. If you know, oh yeah, it's always lumpy and bumpy right here. Oh yeah, it kind of feels like there's a rope under the surface. That's probably fibrous tissue, right?
Mm-hmm.
It's always like that. You're going to notice if something changes and suddenly it's bigger or there's something different there. So that's what I really recommend to people. Do something proactive, that breast massage, lymphatic techniques. I could list a million things you could do, from dry brushing to sauna. It's just a matter
Mm-hmm.
of picking the one that works for you. Some
Right.
people own a sauna and they'll sit in it every day. Great. I don't, but I
Yeah.
have a dry brush and I have a lymphatic vibration plate that I can sit on 5 minutes a day. Great.
Mm-hmm.
Do the thing that works for you, but do something.
Right. I remember when I was in nutritional therapy school, we had a girl, she was from Austria. And we were talking about lymph and stuff one day in class, and she stood up and she took off her bra in class. It was all girls, it was fine.
Yeah.
But she's bouncing them up and down, and she's like, you Americans don't fluff the girls every day. And she like
Yeah.
literally showed us how they fluff the girls,
Yeah.
over
Yeah.
in Europe. She's like, you have to fluff them every day. And so I do in the shower, Maria.
That's awesome. I'm so
Yes,
proud of
because
you.
she's like, you have to know how your own, like you're saying, your own
Yeah.
breast tissue feels, and they have to move, and you got to get out of these bras, and
Yeah,
you
I
know,
actually we have several books in our office for when you're waiting for your appointment that are all about breast health.
mm,
One of them is called Dress to Kill. It
mm-hmm,
is a study, a research study that was done and put into a book. It's just literally the study that talks about the connection between statistically countries who do not have a cultural norm of wearing a bra and the difference in their breast cancer rates compared to
Yeah.
ours. Like, I
Yeah.
know there's food things that are different. I'm not saying it's exactly cause, but it's interesting when you start
It
looking at this,
is.
to see
Yeah.
like, what are we doing and
Mm-hmm.
why? And there's also a really interesting study. I like to post some of this stuff on our social media. There was one that they did, like a 10 or 15-year study about breast sagginess. And they found that women who did not wear bras had perkier breasts by a measurable amount because they're actually using their pectoral muscles.
Oh, that makes
When
sense.
they're just stagnant in a bra all day, you don't
Mm-hmm.
have to. They're just, that's being supported for you. And so if you want to have perkier breasts, ditch the bra.
So then we have to go with cultural norms and
Right, right. Yeah.
I'm not wearing a t-shirt without a bra kind of
But
thing.
there are some great options. Like there are some great fitted tanks that have a little padding
Yes.
in it. I love those. It doesn't even feel like you have a bra on, but nobody can tell because you're not walking around showing it off, right? Yeah, there's a
Yeah.
way to be modest,
Yeah.
and also support your body.
What do you know about like bra toxicity? So just the material that, it's right next to us. It's really hard to find a
Hmm.
bra that's not toxic that actually fits. And
Right.
especially for us bigger busted women.
Yeah, it is. That is the age-old question that I get asked all the time. I'm
Right?
constantly asking my patients even like, tell me if you find a good 100% organic cotton one because they're so
Mm-hmm.
hard to find. There is a corner on the market, I tell you, if you wanted to
Yeah.
create that
I've
because it's
this
very
last year I've
difficult.
been on the hunt for one and I found some for my daughter, but she's a B. And so it's
Right.
really easy to
Yeah.
find. And we've got her some good organic cotton bras,
Yeah.
which is amazing. I can't find one to save my life.
Right. Yeah.
Yeah,
I mean, and I think we have to keep it in perspective too. Like at the end of the day, we can do everything right and still end up with a problem, right?
correct.
And
Hmm.
so if it's I kind of think of that in my own health journey in general. Like the things that I do every single day, yeah, I want to make sure that I'm drinking really clean coffee, right? Because
Yeah.
I'm drinking it every day. I don't want it to be a cup of mold. And so
Hmm.
I'm willing to spend more money on that. Bras, yes, if you're wearing it every day, it's something worth investing in
Hmm.
to find something, but also know that you're doing all these other things, maybe that's just something that you have to let go for now too,
Right.
right? And
Right.
pick our battles because we can't win them all.
We definitely cannot win them all, and that's good. So, is there any last thing that you would love women to know about their health, or anything you want to encourage them with?
I would just say don't wait till there's a problem to look into your health. Again, I can't say enough. Like, if you feel good and you're healthy, you want to maintain that because the
Right.
older we get, every year goes by, our body breaks down a little bit more, right? We're losing muscle, we're losing collagen, we're losing all these things as our body goes into this different season. And so
Hmm.
that's honestly my biggest advice is be proactive, do something to maintain it. Don't wait until there's a problem to start paying attention to what your body needs.
That is so, so good. Well, Maria, thank you so much for being here. I
You're
appreciate
welcome.
you. It's very eye-opening. I hope everyone listening feels more empowered that you can take your health into your own hands and that thermography, as we've learned today, I learned a lot of great things today, is so much more than what I thought it was.
Mhm.
And I actually can't wait to do it for myself. So thank you
Good.
for being here. We appreciate you very much.
Awesome. Thanks for having me. I appreciate it.
Awesome. And thank you everyone for listening. Make sure you like, subscribe, and share. And if you would leave a review for me, that would be the best thing that you could absolutely do. And until next time, stay curious, stay rooted in truth. God bless each of you. Have a great day. Thanks for listening to Take Back My Brain. If today's episode helped you connect with hope or direction, I want you to follow the show, leave us a review, and share it with someone who needs it. And if you're ready to start your own healing journey, explore our courses and our coaching programs at lauriehammer.com/store. So until next time, remember, you cannot medicate away a nutrient deficiency, and healing your brain isn't just possible, it's powerful.